The gurney wheel caught on the threshold of OR2, and I nearly went down with it. And that was how Dr. Everett Shaw and I met. Not with a handshake, but with me swearing under my breath and him saying, without even glancing up from the monitor, "Careful, that's a person, not a shopping cart." I wanted to hate him right there. 24 years old, 5 nights into my first hospital job, after 2 years at an urgent care clinic that closed on holidays. And here I was being corrected by a man who hadn't even looked at my face yet. I'd heard the rumors already, whispered over reheated coffee in the break room. Dr. Shaw doesn't talk to new nurses until they've survived a month. Dr. Shaw sent someone crying to HR over a suture count. Dr. Shaw hasn't smiled since the Bush administration, someone joked, and nobody clarified which one. That night the ER called up 4 traumas back to back, a car accident on Route 9, a construction fall, and 2 others I still see sometimes when I close my eyes, though I won't describe them here because some things belong only to the people in that room. Marisol, my charge nurse, grabbed my elbow in the hallway and said, "You're circulating for Shaw tonight, whole night. It's just the 2 of you and whoever the ER sends up." Her face told me this was either an honor or a punishment, and she didn't know which either. For the first 2 hours, he barely spoke to me except in commands: retractor, suction, closer, clipped words thrown over his shoulder like I was furniture that occasionally moved on its own. I told myself I didn't care. I told myself a lot of things that night that turned out not to be true. Around 2 in the morning, between patients, I found him in the scrub room with his forehead against the mirror, both hands braced on the sink like he was holding the whole building up. I almost backed out quietly. Instead, I said, "You've been up since when?" "Since yesterday morning," he said, not lifting his head. "Go find something useful to do." "That's not an answer to a question anyone asked out of concern," I shot back, surprising myself. "I'm allowed to ask if you're about to pass out on a patient." He turned then, and for the first time I saw him, really saw him. Not the reputation, not the mask, just a tired man in his late 30s with a 5 o'clock shadow and eyes that looked like they hadn't slept properly in a decade. "I'm not going to drop anyone," he said, quieter than before. "I've never dropped anyone." "Good," I said. "Keep it that way. I'm not filling out an incident report tonight. I've got enough paperwork." Something moved at the corner of his mouth. Not quite a smile, a down payment on one. By 4 in the morning, we'd lost the construction worker's arm. Not him, not the surgery, just circumstances nobody could have outrun. And I watched Dr. Shaw stand in the hallway afterward, with his mask pulled down around his neck, staring at nothing. I've thought a lot since then about what we owe the people we work beside in moments like that. Do you say something? Do you let them have the silence? I still don't know the right answer, and I suspect there isn't one, only the choice you make in that particular hallway on that particular night. I chose to stand next to him, not talking, just there. After a while he said, "My father was a mechanic. He used to say you can fix almost anything if you catch it early enough and you're not afraid of the mess." He looked at his hands. "I keep waiting to feel like that's still true." "It was true tonight, 3 times, I said. "Nobody remembers the 4th one wasn't your fault, except you, apparently." He looked at me sideways, like I'd said something he wasn't expecting from someone he'd been treating like a coat rack for 6 hours. "What's your name?" "Really? 6 hours in and you're asking now?" "I asked Marisol for the new nurse's chart on day 1, he said. "I know your name. I wanted to hear you say it." I felt that answer somewhere under my sternum, unwelcome and warm at the same time. The exact feeling you get when you realize the person you decided to dislike has been quietly paying attention the whole time you thought you were invisible to him. The sun came up around 6, that grey hospital parking lot sunrise that never looks like it does in the movies, and we ended up on the loading dock with vending machine coffee because the cafeteria wasn't open yet. He apologized, sort of, "I'm not good with people when it's slow, and I'm worse when it isn't." Which is maybe the most honest thing anyone had said to me in a month of small talk with strangers in scrub caps. I want to tell you it turned into something simple after that, but nothing at that hospital was ever simple, and neither were we. There were months of near misses, of him leaving coffee on the nurse's station counter and neither of us naming what that meant. Of me telling myself a dozen times that surgeons who run hot and cold aren't worth the whiplash. And then that same night hallway pulling us back together anyway. What I keep coming back to, telling this story now, is how close I came to writing him off in the first 10 minutes over one sharp sentence, when the man underneath it had been standing on his feet for 22 hours trying to keep 4 strangers alive. I wonder sometimes how many people we decide about before we've even seen them tired, or scared, or standing in a hallway with nothing left to give but the truth. I don't know if that's forgivable carelessness or just being human. Maybe you've done it too, written someone off in a hallway, in a doorway, in the first 5 minutes, and only found out later what they were actually carrying.